What it could be, what it should be. Okay, so I'm back. I took the cap off. I brushed the, I think, yeah, I did. Because I said after, it's like, almost 2 o'clock. It's like 1:56 in the morning. I thought I saw 1:56 there and I squinted, but I saw here's 1:50. I can never watch on my own. Anyway, the reason for that is I did mention now in my prior video that I'm going to address some issue with my males around there that's ashamed to talk about certain things or ashamed to say certain things, admit to certain things. But most of all, I think if it is true what they're saying, that they don't partake in certain things, now is the time to start partaking because it's for your own good. What I'm talking about is um, masturbation. Um, I'm saying what we call in squabbling, so to speak, in South African terms, in our terms, but I mean for the rest of the world, masturbation. I don't know if one day maybe this goes international, then we won't know what I'm talking about. But anyway, guys, it's not anything to be ashamed of. A lot of guys don't admit to it. Look, it is private. I get that. I talk about it. I don't give a fuck. The reason I brag about it is because just to know that I'm healthy with and I'm in check with my body. You know what I'm saying? Because the thing is, like I said in my previous video, if you're married or whatever, and you're having sex every day, if your wife suck, if you're getting your dick sucked every day, it's not like whoever sucking your dick, be checking for lumps under your balls or some shit like that. To tell you, oh no, um, well, I sorted you out, but um, just a roadworthy chick, like you're taking your car to get a roadworthy chick. You want to have it checked out because you have a little lump under your left nut there. You want to might want to inflammation. You might want to have checked out by the doctor or something like that. It's not like you don't get no fucking the report back after they done down there. Especially them that like to live up and suck the balls and shit. I don't know what they do, how they do it, but I have no experience in it. So yeah, they be able to tell you. But I mean, they all they might as well check. Say, hey man, you got something, something, amiss here. I'll just write this up. You just give it to your doctor. Just tell him Elizabeth checked you out last night. Sent you here. I mean, if bitches could get referrals for that, I think they must get the referral system for all them good dick suckers out there. To once you're there, check for these anomalies, lumps or whatever irregularities in the balls, um, and then just get you like a pad, write it out, and then with a QR code on it, the doctor can scan, and then you like get a 50 rand for saving a nigga's life because you prevented. Prevention is better than cure, but what I'm talking about is prostate cancer, which is evident in males. I know it took 3 minutes for me to get there, but that is what the main reason is. Um, and if it's not for uh, that feeling, um, euphoric feeling you feel when you ejaculate, then it's for health reasons that you need to start acquainting yourself if you're not acquainted with your body. Because let me tell you, and let me just see when does this prostate occur. This prostate cancer situation occur. So hemorrhoids. I don't want to know what it. Okay, so let me first tell you about from what I've seen. If you haven't, because it's not. I know it's not something that's spoken about quite often. But it is something. Sorry, man. I say behold, my eyes is burning. But it's because I'm starting to get sweaty and keep on putting this fan. Um, it's not it's spoken about as breast cancer in women and whatever the case may be. Generally because men don't want to speak about these kind of things. Fuck that. I speak about it because um, you need to speak about things. Sorry about that. You need to speak about things that to give it less of an embarrassment factor and less of a power over you to feel belittled or small or whatever, or you don't want to talk about this because it's embarrassing. There's nothing embarrassing about it that happens. Now, the thing is, when I experienced, or when I came to, the reason why I got onto the prostate cancer ban, I was about 21 or 22 years old. A very close family friends, um, which was a family friend of my mother, them. So they were obviously older. They were about, my mom was about, what, 62 now? If I was 21, that was like, you know, she was like 45, you know. I don't know. I'm trying to count, but fuck it. It was 15 years ago, I think. Anyway, it was the first time I experienced, and so it was one of their friends who was in that range or age range. Their parents, which was now obviously over 60, was diagnosed with prostate cancer. Fam, it's not a fucking joke. Because I don't know, like cancer in general is fucked up, and you have to go for radiation therapy and whatever the case may be. I don't know if this sort of cancer. I'm not sure. I don't know the facts. I didn't really. I just, because when I saw that person, and then a few years later experienced another. I like saw three elderly people get prostate cancer and die of it. They say it can be cured. I haven't, but the three, I always go with my, they say there's a difference between a clever person or a smart person and a wise person, and that's just that a smart person has done all the research. They have the book knowledge, they know the theory. A wise person, they have experience in the shit, so they know that what the application is and the outcome of the matter, and they can give you their wise opinion because they know what the outcome is. You remember, theories are only theories based upon, could be written by other people what their experiences are, but remember, in everything there's always a twist, like what somebody experienced. Remember, these text shit was written in 1978, 1982, 1990, maybe 1994, 2000, or whatever. Say last edition was written in 2010, but technology has changed, people's minds changed, people's perspectives changed. So all the different elements or all the different things that exposes your experiment to, that your experiment is exposed to, regardless of what they might have had an experience in their time when they conducted that experiment in 95. The climatic conditions was different, and I'm not meaning climatic conditions like the fucking weather. I'm talking about in general habitual shit that people used to do. People didn't have fucking WhatsApp and technology in 94, so they acted appropriately as human beings. Whereas today, people don't give a fuck. If you can see someone shot today and not be traumatized, they could have stood in front of you and you could see the bullet enter their left frontal lobe and exit on the right, then fall to the ground. You can see all that blood splatter. You might not sleep for a day or two, but it's not going to haunt you as much as it haunted someone seeing that same shit happen in 94, because we weren't used to it. Because that time the movies were still, when they shoot you, you see, they got shot. But the scene is when the person got shot, they switch to another scene and then they come back to you and you're laying there, but on your face, and they take it from afar. Nowadays, the movies are fucking, they show all the blood and gore in exit wound and entrance wound and blood splatter all over the fucking place. And so for you, it's like a fucking movie. Once you see someone shot in front of you, it's like that Kak Van Damme movie you watched, or whatever movie you watched, Vin Diesel movie you watched, or whatever new Kak is, and you can go home, you can go sleep. Maybe the reality of it in your subconscious will ply you for a day or two, but after 2 days, 3 days, you straight. That person from 94, that still wants them over and over and over. They see that same shit recurring. So it's just one of those things, right? But with the prostate cancer thing, guys, it's fucked up. Like, and this was the experience. So the person got prostate cancer, they had prostate cancer. They said that it was really too far advanced because of not picking it up early enough. It was already an advanced stage of prostate cancer, so they just had to go home, live out their last days. That last days turned out to be 3-4 months, my bro. All three cases that I came across, those 4 months, it's not that you can't walk because you can't walk because your legs don't allow you to. You can't walk because my bro, you like I didn't see it personally. This is what I've heard. I didn't want to go. I didn't want to see it, and they never gave me the opportunity to see it. And even if they did give me the opportunity, I wouldn't have gone to see it because I take your word for it, right? So you have to wear a diaper. Your balls are swollen. I don't know. They say watermelon big. Look, can understand if they exaggerated a bit. Why they would say watermelon big because it looked that way, but your balls being a lot bigger than what it is already. Think about it. If your balls is two, let's say it was twice, let's make it okay, maybe 2 times bigger. Some people enjoy it because their balls are small. But I'm saying if your balls were three, like I know what they said is 10 to 20 times bigger, it swells up in size than what it normally is. Now, think about your nutsack being enlarged 20 times bigger than what it is. My bro, there's no way you can walk. Now, when you touch that motherfucker, apparently it's painful. I don't know. I'm taking it from the people that were there to undress and redress this person. Obviously, the person had a catheter in, so they pissed in the bag, so they just took the bag and threw it out. They had to move the person. Obviously, the person shat in a nappy, so they had to change that. But in changing that, they would have to touch these 20 times bigger swollen balls. But when you touch it, it's painful. This growth in there, or whatever the fuck you want to call it. So imagine that. So besides having a nutsack that's 20 times the size of what it is, imagine without it, even if you touch it, it's painful. Knowing that when you're nuts, if somebody just grazes your nuts, it's painful. But let's say the pain wasn't there. But just imagine 20 times bigger nuts than what you have right now. Try to walk with them, motherfuckers. You're gonna crush them on every step you take. Because either you're gonna have to have them in front, or you're gonna have to have them behind or by your ass side. But as your legs, it's gonna go between your legs. So you're gonna have to have something that lift your underpants that you can tie up here to have it lifted up. But you're gonna walk with 20 times bigger nuts now. Your nuts is gonna be out there. Everybody's gonna be able to see you. But not just fuck what everybody else thinks. This is not just you plainly trying to walk with 20 times bigger nuts. Now imagine every time your nuts move or you touch it, it's painful. When you have piss, it's painful because in the piss has sometimes got blood in the urine as well. That I did see the urine bag there with some bloody. Every time the urine pause, you'll see some bloodiness in the urine. That type of shit. It's fucking painful. And now imagine you go through this shit for fucking 3 months, my bro. You don't die immediately, but I mean, we know nuts is fucking delicate. So why not now already or throughout life take the preventative measures to fucking avoid that type of shit happening? And this happened to all three people. Nuts got swollen exponentially. The pain to pee, they used to cry. It was, I mean, they give you morphine and shit, but my bro, and that's the other thing. When people and when I see people pause it, way to pause so hard on drugs, you die a drug addict basically, but you're on drugs to die in the pain. But you 3 months, you just drugged up all the time. You don't know who you are anymore. You don't know the people around you anymore. You accuse people of what trying to kill you, all this type of shit. But anyway, forget what I'm talking about. The pain that you have to go through, your nutsack. Like I would rather take my bro, cut the shit off, and then leave a pipe in there for me to piss with, if need be. But then your manhood's gone. You know what I'm saying? But I'm saying to prevent that shit, there's measures you need to take, and the measures is number one, when you urinating and you finish urinating, make sure you completely finish urinating, because at times you urinate, you're so in a hurry that you urinated, you shake off 2 times, and you still have some leakage, or not some leakage, but there's still some stuck in the urinary tract. So now what happens is you pull up, you clinch up, sometimes it will leak out into your underpants and that. And I'm talking this shit because this is real shit that happens. It will leak out your underpants and you notice later in the day you smell like piss sometimes. And this is not this has happened to me once or twice before. But that's because of alcohol use and not getting enough sleep. But then that's what caused the alert in me, because I got scared after the first time I experienced someone with prostate cancer actually. And every time after that, and I'm going to tell you some other experiences of mine as well. But yeah, the first thing would be when you urinate to make sure that you're not dry, but you got all the pee, even the excess pee out afterward. But they say if you shake it more than twice, you're playing with it. I don't give a fuck. I play with it anyway. So fuck you, neighbor, whoever's the end of it. You feel I'm playing with it. I'm playing with it. It's my shit. I can play with it. Because at the end of the day, this is your best friend. This is the best friend you had since you were born. So your ass need to acquaint yourself with that friend if you haven't been acquainted, and apologize to him that you haven't been fucking paying attention to him, because you need to make sure that your shit is good, my nigga. That's why I'm looking into the camera with my eyes, and to tell you need to make sure your shit's good. You need to make sure your balls is good. If you don't want to do it for pleasure, do it for your fucking health. You need to make sure your shit's good. Shave that shit every now and then to make sure you can actually see your shit if it's bushy, and make sure that, okay, my eggs is alright. Lift it up. You'll see, if you didn't know this, you'll see your eggs have this, your testicles have this way of, it's almost like it has a mind of its own, like its own heartbeat, or like it's breathing. If you're not doing that, nigga, there's something wrong. You're just dead, my bro. You'll see it's kind of, it doesn't stand still when it's moving around there. So you need to make sure, do this shit. If I don't know, maybe I have alien testicles if mine do that, but you need to do that shit. Like I say, play with it, shake it off, make sure that piss is out there, nigga. The other thing that you need to do is you need to ejaculate at least twice a week. Hence, that's why you get wet dreams, because your body needs to renew and replenish that shit. You'll notice that sometimes your semen will be pure white color if it's new semen that's been produced of late. Other times, if you save it up, it will start coming off whitish or whatever, look like a t-shirt, white t-shirt you threw in the jug too many times. But that is because you don't fucking, you need to regularly fucking replenish. You need to handle that shit. You need to empty that shit out, because also if you're trying to get children, you want recent babies. You know what I'm saying? You don't want that old cock there of 3 months ago in your shit, because yeah, you don't want that old baby cock. That old niggas be your babies, because you see, what type of an eye were you 3 months ago? Now you still got 3 months ago coming in you. You come that into some woman, and that produces a light here and then. Now you think, yeah, your nighty come out, yo, this light is most an eye. Turns out to be an eye and whatever. Take stock of how you were when you conceived this kid. Take the date they were born. Alright? Go back. Take the date your lighty was born, and then count 9 months back if you didn't know. More or less 9 months back. That's more or less when you conceived this child, when you and your lady did what you did. You did what you did. You did it to me, shit. When this kid was, what's the name? Now, whatever you do, remember, it takes one of them little motherfucking swimmers. Your muscle. One of those, you know what? Fuck you. I don't know why I fuck this thing now, but anyway. Fuck it, stay there. So it takes one of them swimmers for this baby to, so one of that little millions of those niggas that you keep off at the time to get there. But now, count 9 months back. And then you count, and you say to yourself, okay, let's say this is the day I conceived my lady. And you think to yourself, when last did you replenish your shit on that day? And then you tell me. Now, if you were daily, I get shit from my mochi every day, kind of, bruh. Then think about what type of person you were at that point in time, then. And if you were 9 at that point in time, and your light is an eye, or your daughter's an eye, then it's because you were an eye at the time. Maybe even after you learn now you're going to be a father, now I'm going to change my ways now. It's too late. She's already been fucking injected with that naïrigheid. He must now first learn that he's a night out in life, and you must try to your best to get it done early. But at the time of conception, he was a knife. Now, say for instance, you didn't take a knife for 3 months. Now you moet give you a stukje off to use for now on a dry spell for 3 months. Yeah, you give you a stukje. It's 2 seconds of your life, you just drink it into a sticker. Now she's talking the cock of, no, it's always on the, you know, when the cock is sick and everything, you're somebody conceiving a baby. But here's the thing. So you got ejaculated, so you were at cock gedachtes last 3 months ago, all that cock gedachtes, but the last 3 months. Now, say a month ago you changed. And now your muchism decided, okay, now I can see the change in you. been a month. I want to give you a sticky. Now, 3 months ago, you got your sticky loss. You didn't do nothing to get that off. You still have that zaad with that kakgedachte in the mochi is pregnant. Now the light come out with that kakgedachtes. So replenish every day, every fucking day. Bring your fucking, I'm not saying every day, but I'm saying bring your sperm up to date with times. You know what I'm saying? My shit is not older than a week. I make sure whether I like it or not. Tonight I was talking about the cock. Normally Sunday evenings, and I missed it now. Sunday evenings, born. I'm going to a new week with old shit, my bro. That's why people come to work with that kakgedachtes all the time, or whatever, or they go into life with that kakgedacht. Make sure on a Sunday, now you're a new person, totally on the Monday, you know. But back to what it's about. You need to ejaculate about twice a week to get that, to prevent, not to prevent, but in your quest to prevent from getting prostate cancer. Because, like I said, you don't want that shit. And CB 21 minutes in. You see, I can't talk fucking short. I thought it was going to be a 10-minute video. But anyway, here's the other thing. If you feel that you have problems, or just you wanting to know, and especially in the when you get to around about 30, I haven't gone for this of late, because in the new job I have, I don't have medical aid. But when I had medical aid, once a year, I always went for a full checkup, because arthritis, cancer, diabetes, and so on is in my family. So my grandparents and all passed away of certain type of cancers or diabetes or whatever. My dad, most of his brothers, my uncles, my aunt and my uncle, they had cancer. They were cured. I'm not too sure, but they say that stuff comes back sometimes. So God forbid, but yeah, they're fine now. And I know a couple of youngsters that also had cancer. Some beat it, some didn't. Some different types of cancers, but it's just one of those things, that you need to. So I used to go for those checkups for all the stuff, blood work, and all this tests. And I'm gonna tell you something about my experience. And again, I know it's late in the fucking. I'm not gonna give this in the beginning. I can make a 10-minute segment and start it out. But now you must watch each 10 minutes. I might as well tell you everything one time, and you can go through it. But you won't find the funny or whatever in it. But anyway, so in the beginning, so I'm like, okay, I go to the doctor. I've experienced this, and it was plying me this whole prostate thing, but I didn't immediately act on it until it was after one sexual experience that I had. I was about 26 or something like that. 26, between 26 and 30, around about 26 and 30. But but I wasn't 30 yet. I was about 26, 27, 28. I bought some underwear, but this tight fitting, I was like jockey in my younger days, because I just felt that, sexy with that pouch and whatever. And you have the jockey name, you're on the band, and if you lower your jeans and you see the jockey name, all that type of shit. So okay, I'm actually telling you what the problem was, but what happened was I had a sexual experience, and then a week or so later, I proceeded to do my ritualistic thing to check myself out, and then you're like, oh shit, seems like there's a sort of blood in there as well. And I was like, oh fuck. Google this blood thing. Hey, first thing that comes up, sign of prostate cancer. I'm like, don't talk cock. So I lied to the doctor. I use that. That's normally my 2 days I get off in the year, kind of 2 6 days. But I go to the doctor hospital for the test for the diabetes and so on. And this time I add in the prostate thing, because now I'm worried. I saw this bloody, and I didn't sleep for 2 days. I'm like, fuck it. Okay, I'm gonna make this appointment with the doctor for that normal annual checkup. Secretary books it for 2 days from now. I go there. Like, doctor says, my secretary said, put here that you wanted to add a prostate situation. He asked why. I said about the bloody urine. He said, okay, no, it makes sense, etc. Now I could see in his face that he wanted to say, look, it's a bit too early for it, but he went with it, and he let me go through the experience, because he only told me afterward, like, normally you need to worry only at this age, about 36 up them. But at the time, he let me go through the experience. So what happens is, so he says to me, we're going to do a digital test. I'm thinking, why? I don't know where prostate is situated even at the time. I just know it has something to do with my pill. And I'm worried. So I'm thinking, he might touch my tummy. He's a doctor. I don't care anything about the size. It's not like he's a lady doctor. So it's a guy doctor. So cool. He calls the nurses to prep. Another nurses prep you. They put the blood pressure thing on, and then they must obviously throw your blood, like 7 vials of blood. And I, like, man, and I'm sweating because I had experience with needles and shit. I have this phobia with this when they have to put you on drips or some shit, because when I was very much younger, I had gastro when I went to hospital. They stuck the drip miss in my arm, missed the vein, and it was there for like a couple of hours. But anyway, fuck it, that's another story. So anyway, so I sweat and I profusely when it comes to needles and shit. So anyway, they take the blood every year, whatever. So I'm like, okay, but it's a nice looking nurse. I'm like, okay, so I don't know if she's gonna be doing any of the other work. So in my mind, I'm already, I'm getting myself semi worked up for the shit to be semi. Whatever. So the doctor comes in, pulls the curtain. You have to put your pants down. You have to lay on the bed, put your pants down, and then you have to now lay in the fetal position with your knees as close to your chest as possible, like in a ball, right? This is what a digital test is, and I'll tell you now why they call it digital. So I can feel some sort of draft because he obviously lifts up this veil that's now over my midsection. Then I feel that it opens your ass up and asks if you, it tells you to relax, feel some coldness because put some cold gel. So then they put this ice cold gel on your asshole. I'm gonna finish this here, but anyway, put this cold gel on your asshole, and then he proceeds to put his finger in your bum. This takes about, digital test takes about like a minute and a half to 2 minutes. If this test goes beyond this 2 minute mark, this doctor's fucking around with you. Because I've had this done 3 times already. So all 3 times, different doctors and the same. So it was 2 minutes flat. Actually, less than 2 minutes, but I'm saying 2 minutes because so they put their finger about and they just tend to feel. They also do like press. Okay, and then you're done. Now the first time it was like, oh shit, and it was like, but the other 2 times because I knew what to expect, it was fine. The doctors thought I didn't know what to expect, but I knew what to expect. But the first time was a bit funny to feel, but they just need to feel the nodes in your whatever balls in, so to speak. But why I'm sharing that is because it's not embarrassing. It's nothing to be embarrassed about. It's just that I need to reiterate that you need to take care of yourself. Now, there is things like exercise, drinking teas, adding citrus fruits to your diet, like oranges and shit like that, to that acidity to burn down, because that acidity burns down whatever the fuck that's on those nodes or whatever. But we can't always afford to have oranges around. We can't always afford to have coffee every day and all that type of shit. But we can afford it. It's no cost. No money is free hand, bro. Free hand. Take that shit. Examine yourself. Get that shit off twice a week. If you have a wife that's there, if your wife ain't gonna like it, then you must then have your wife or your girlfriend examine your shit. Write your shit down. And if there's any problems, go have yourself checked out, so that we can prevent prostate cancer, because it's not so freely spoken about and openly as breast cancer. It occurs a lot. People just don't speak about it, and that's why it mainly leads to death, because it's always only picked up at a very late stage. There is also some exercises you can do, bum busters and so on, to stimulate you, keep your prostate in. So if you see me bouncing around on my chair at work, you know why it is. I'm just bum busting to keep my prostate in shape. Anyway, I think I'm going to keep my videos all down to a 30-minute mark. So I'm reaching 29 minutes, 33 seconds. This is your boy Martin here on the prostate situation. There's way more I can tell you about it, but just the awareness. And what I'm going to say is scomo. That's the word of the day. That's your boy P. I'm be out in this fucking thing. I don't want to stay here. Yeah, I fucking lose this thing. Let me fight with this, and I will be out.